Hello, everyone from Psychology 513, Mind and Brain. This is going to be a short lecture on gamma wave activities. This was inspired by Dr. Lawson's articles as well as some articles that I picked out. So first, I wanted to talk about the importance of gamma waves. So according to Wilson and other researchers in 2012, gamma waves from 30 to 120 hertz is important for complex information processing. Now, they also found that it is critically dependent upon local internal network integrity. And in this article that I'm about to mention, Rubric 2011, it could possibly link to positive emotional states. So the first article I wanted to talk about was by Beverly Rubric and was published in 2011 called Neurofeedback Enhanced Gamma Brain Waves from the Prefrontal Cortex Region of Meditators and Non-Meditators and Associated Subjective Experience. So the key findings of this study was that participants of both the non-meditator and meditator group had similar ability to produce the gamma wave bands. And more importantly, that the gamma wave band made participants feel more positive emotions and a reduction of negative emotions. They also found that there was no initial difference in gamma wave band frequency in meditators and non-meditators. And although that this study is very nice, I have a few issues with the study. So number one, the study excluded individuals with ADHD or physical disorders. As someone who loves the abnormal psychology of things, I feel like there was such a potential to study individuals with ADHD. Another thing that was kind of a big issue with the study was that they mentioned how future studies would increase the duration of the study with EEG. And as someone who works in an EEG lab, I have been told multiple times that after a while it gets a little uncomfortable. So I don't think that that's the best method of going about this. And my last criticism with the article was that the findings showed no significant difference between meditators and non. And the my main issue specifically is the method that they used. And they even mentioned how in the article that transcendental meditation was not good at capturing gamma wave or enhancing gamma wave and alpha wave activity, which kind of brings into question, why did you choose that specific meditation technique? So my main focus on this whole presentation is, could the results of this study relate to mental disorders? And so I'm trying to find, a possible linkage between mental disorders and the gamma wave band. And like the article mentioned, if gamma wave frequencies created positive emotions of participants, could the absence or abnormality of gamma wave activity cause negative emotions? Could abnormal brain patterns and gamma wave frequencies correlate with some mental disorders? And so I found this source by Williams and other researchers published in 2006 called Missing Links in Borderline Personality Disorder, Loss of Neural Synchrony Related to Lack of Emotional Regulation and Impulse Control. And so I kind of wanted to discuss about some of the key findings of this study. So they found no significant global gamma 1 and gamma 2 synchrony differences between the control group and the bipolar borderline personality disorder patients. They also found that the magnitude of gamma 2 synchrony was also found to be significantly reduced in the right hemisphere for borderline personality disorder individuals compared with the healthy control subject, possibly influencing context evaluation. They also talk about how a delayed posterior gamma synchrony and the reduction in the right hemisphere's gamma synchrony could be associated with impulsivity. And so this quote by the article, I feel like best summarizes some of the results of the study. And it says, our observations that patients with BPD also had a delay in both behavioral response and SCR onset. It's consistent with a breakthrough in orienting to salient stimuli. And so there were some issues with the study. Number one, the study only used unmedicated individuals with borderline personality disorder, but also like the subject pool that they chose were those who had the most severity of the symptoms. So if someone has borderline personality disorder and they're on medications, some of the results in the study may not correlate with them exactly because these participants that they chose were those admitted into a mental health hospital because of their borderline personality disorder symptoms and they were unmedicated. So you could possibly, in future studies, figure out how the borderline personality disorder medication could influence this, not this gamma wave synchrony. And also, the article mentioned that the interpretation of the data was one of the major issues with this. And yeah, so my third and final source is by Wilson and other researchers, published in 2012, called Gamma Frequency and Neuronal Activity is Diminished in Adults with Attention Deficit Hyperactivity Disorder, a pharmaco-MEG study. And so the key findings of this study was that adults with ADHD showed significantly less overall gamma wave activity during the pre-drug trial. And the distribution of this MASXR medication helped increase gamma wave frequency. So they also found that an overall significant gamma increase in post-drug trials compared to pre-drug trials. But this effect was not, did not differ with the healthy control group. And there was no regional specificity regarding the gamma wave abnormality. And so this study also has some potential issues. For starters, the sample size they mentioned, and they also mentioned older samples and the absence of a placebo control group. So connecting everything together, the three articles together, what can we learn? And so the first article by Rubric mentioned that meditation found an association between these positive emotional ratings and participants experiencing the gamma wave band. In the ADHD article, they found that individuals with ADHD overall showed a reduction in gamma wave activity. And in the second article mentioning borderline personality disorder, they found abnormalities in the gamma wave activity. So it's kind of begs the question, how much does gamma wave activity affect the development of these disorders? And so I feel like future studies could study mental disorders and also possibly meditation, how, someone with ADHD who is learning how to meditate, how that would increase gamma wave activity or try to correct the diminished gamma wave activity of those with ADHD. And so here were some of the reference slides. And so I hope everyone learned a little bit about gamma wave activity and also, some of the abnormal psychology, regarding gamma wave activity. Thank you.